Hello everyone, I am Dr. Priyank Patel and I am a consultant spine surgeon with VR Spine. Today I am going to discuss a very interesting case with you guys. This gentleman is 74 years old and has been having back pain for quite a long time. In this, he had a minor jerk after which he developed a fracture in the back. And gradually, what happened is his mobility started going down, and over the past 3 months, he completely became bedridden. Uh, because of one severe back pain, difficulty to move in the back, and somewhere the nerves got damaged and he lost sensations and movements in the legs. I'm going to quickly walk you through the MRI and show you why this guy is having so much problem. So, see, if you look at this, that's your entire spine. So that's your brain, that's the lower part, that's the front, that's the back. Now, spine is just like a building where there are multiple floors, and in between floors you've got intervertebral disc. Like how there is an elevator shaft in the building, there is a central canal through which the nerves start from the brain and go down here. Now, this gentleman had a fracture at this part. So you see this bone where there's this whitish part that's actually fracture filled in with fluid. Now, unfortunately, what happens is if the building is broken from between, what will happen? It will start collapsing. And as a result, what happens is that the nerves start getting pinched over here. Now, you all have heard or had people who have had fractures. Whenever there's a fracture, there's movement in the bone, and that causes terrible pain. That's the reason why this gentleman was having so much pain. And unfortunately, because the fracture was in such a area, the nerves got pinched, and that gentleman lost power in the legs. Today, what we have done is a surgery where we are filling up this fracture and stabilizing the spine. So, consider it like a building which is about to fall, and you support it with bamboo and start repairing it. That's what we are doing. This will immediately get the patient up and about. So, at least he'll become comfortable, he'll be sitting up, and we'll be able to moving around in a wheelchair. And if things are in our favor, his nerves will start recovering, and we hope that in the future couple of months he starts walking initially with a walker and then walking independently. So that's what we are doing today. Thank you everyone.